needs no introduction. He runs the most well-known Narayan Netralaya, very research-focused in clinical practice. And he's actually brought a dimension outside government hospitals where research is being done in a manner that is internationally recognized. And very few know that he recently got a PhD from the University of Maastricht for his research in keratoconus. And during the panel discussion, we have a very interesting guest here, Mr. Dave. And I happened to have dinner with him last night. I'd like him to stand up. He's come all the way with his wife from Sarasota. And you know, it's very interesting that Lalit, he's by training a marine biologist. And he'll tell you a story in 5 minutes how, because of his love for his wife, he went on to train himself to be a male nurse and optometrist and worked at none other than at Baylor's in Miami at the VA to be able to do ophthalmology without a degree in America. So things can happen.
Thank you. Thank you, sir. My talk is research a viable option? The reason we have to look at it as a viable option is I heard this from a very close friend of mine when 16, 17 years back. He said that your future is not an extension of your past. So if your future is not an extension of your past and what is happening today, there's absolutely no way what is happening today is going to be the tomorrow. So if you want it to be a viable option, you have to look at it like a viable option. And if you don't have a clear philosophy, why you are doing it. For example, you're doing it just because you get a podium here, a few papers, promotions, etc., etc., etc. There are many, many reasons why you want to do it. If you don't have a clear path, then it's never going to be a viable option. For example, this is what our path was. Viable or not, I think history will tell, because it's impossible to know. It's not like a return on investment in a year or 6 months. It's impossible. That's because I don't know what the denominator is to call it viable. So this is what we thought. We were very curious. A lot of people had to be curious. A curious mind, a group of minds, or like Dr. Lalit sir said, a group of people can have questions. And many questions we don't have an answer. You start looking at an answer, and whatever answer you do become translational. And then that is what it becomes to your clinic, and that's exactly what research is all about. And if you put a denominator as a criteria of success, then for each one you can actually put. You can put for curiosity, questions, answers, papers, how much money you get, how much grant you get, and all these issues. So I'm not going to look at the financial part of it, because if you look at only finance part of it, research is a failure because it doesn't pay. People don't pay you and until unless you become big grants or you do some big patents and all that. That takes time. I don't think we have reached that stage where, you know, whatever you do, we are reaching that much of financial independence. So till that time, let's look at just as passion, you know, because like I said, a lot of things you don't do. Sometimes you do things without a reason, and that reason you yourself don't know. For me, the reason was question, and personally, we have had at least 4 or 5 PhDs finishing from a clinician point of view, because I told them, all of them need to have this question. I had met a chemistry Nobel laureate. I think he won in 1990s, late 90s or early 2000, and he said a scientist should always ask this when somebody says as smooth as butter, because that is the real way how science will progress. If you just accept it as what it is, then there is no way the science can take forward. There's a lot of areas if you want to look at it as a viable option. So start questioning what is known. There are enough things what is not known. The world is moving towards biomarkers, imaging, clinical, psychometric biomarkers. How do you apply? And then you start looking at the future. This is the way, a circle of how it works. So what really happens is the people who want to look at it as an option, that is like Dr. Lalit said, you have a clinics. At some point of time, you burn out. You feel it's a melting point. You've done your part. There's nothing more you want to do. You are skilled enough, you've done everything, all the technologies you have, it's there with you. Then what do you do? So the biggest challenge today, I think he would agree, and a lot of seniors he would agree here, is you get fatigue of doing the same thing again and again. Because you go to OT, it's the same thing, same LASIK, same smile, you don't have anything else to do. And what do? That's where you have to find the magic. If you don't find the magic, at least in today's world, at least 18, 19 years post your busy practice, you're going to fizzle off. I think each one of us are going to do it. And if you don't pick up something, that's why a lot of people in the Western world have different other areas of interest. But I don't know in India how easy it is to just pick up one new art. For example, you become a musician, you play guitar. It is difficult. At least in Bangalore, from my house to the hospital, which just across the road, I take 15, 20 minutes. So there's no point doing anything after that. So the basic algorithm is you choose an area of interest. And once you choose the area of interest, you chase your limits. And you have to add spice to your daily routine. Adding spice to your daily routine is you get awards, you get called, you get patents. And these are the ones which makes you viable. These are the ones which is your denominator. This is my denominator. I mean, each person can have his own ones. Research can be anything. It can be in your own clinic. You don't even need to be a lab. Lab makes it fancy, but it is not the only thing. It can be a clinical or epidemiological work. I think a lot of big hospitals like Arvind, Shankar Netra, they all started with basic epidemiological big datas. And that's what made them to reach where they are. And then you can go up to the other ones, if you have access to it. I mean, there is no limit to anything. You can find, if you want something, you will find something there. This is what I tell a lot of my fellows who come to us. There is a search, clinical skill, there is a research, there is award and recognition. You have to do a pizza topping approach on it when you choose your career. So for example, you have to pick up what you want to do. And each one you can actually do it today. Because sometimes it becomes a herd mentality. Okay, my friend did this, I'm going to go to the same place and do it again because he did it very well. What suits your friend may not suit you. You have to pick up a lot. Each one you pick up and you become your pizza topping. For example, somebody say, I just want to do a long term, I want to do my other exams like FRCS, ICO, and I want to do some research. So you narrow it down. You'll find some place which can offer you all this and then make your own secret sauce. There are 5 points I'm going to show what really is a barrier. Today is always about facilities. But I think the world is changing. If you really look out of your room, of your clinic, you start talking to people, even it is there. There are so many people, so many places which are ready to work, but you have to extend your hand. Lack of knowledge, again, there are a lot of courses today which keeps telling you about courses, good clinical practice, ethical practice, research practice, and even places like Arvind and big institutes are conducting that. And for example, if you don't have a question that research doesn't work, you have to find a question for this. Again, there are online statistical courses which helps you to do that. Lack of access to research finding, this is the biggest problem in our country. We do not have research, online, free access journals. Sometimes this is one of the major reasons many places don't do research because I want some paper to research, but I don't get it. So unless we find a solution, there are so many senior people here, Grover sir is here. The reason when I did my assessment is in India, this is the major problem. I don't know whether it's just a reason given not to do, but this is one of the major issues. Lack of time is a big challenge. Again, a lot of us have to do a work after working hours. Unfortunately, we don't have the luxury of having research off, even in an institution like us, because it is difficult, because your practice where so many things are dependent on a lot of human factors, time off, so you have to do extra hours to do research. That is one of the major barriers. I'm just looking at, this is not a barrier, but I've just points which we need to look at. Sufficient skills, again, I'm seeing in the last 1 or 2 years, many organizations are coming up with helping them to develop the skills. These are all necessary. If your GPC training, the good clinical practice training is very important before you start any research. And unless you do that or take a course which you're certified, doing research is going to be risky. I mean, many places do ask you for this. And the most difficult thing is the understanding the jargon of research. I mean, what kind of research you want to plan. So that's why you need to sit and plan with people. Finally, the research is what it connects everything from biology to mathematics, and there are a lot of areas which are out there which helps to make it better. Thank you.